Maria, I'm so sorry, and to everybody, my name's Helen Pratt, and I'm presenting alongside colleagues today, and I have a broken camera. So what I've done is I put a picture of me, which was from when I started working for the partnership 3 years ago. I don't look anything like that now. I look withered, worn, as Marion and Ruth will say. I look exhausted. No, I don't. I'm joking. I'm sorry, I can't put my camera on, but it is us presenting today. So, but we've got slides, so you'll see something rather than nothing.
That's okay. So just to quickly introduce you, so everybody that's here is hopefully here for the Living Well with Dementia Greater Manchester breakout session. It is being recorded, so you can get the recording after as well if you want to have a recap or any of your colleagues that miss it. So we've got 3 presenters today, one of which is Helen, who was kindly just explained that unfortunately her camera's not working. So Helen Pratt is the project manager for Dementia United, and she works for the GM Health and Social Care Partnership. With Helen, we've got Ruth Turner and Marion Coleman, who are both from the Dementia Carer Expert Reference Group. We've got 40 minutes. We have got a little bit of a Q&A time allocation at the end, so if people again want to put the questions in chat, that'd be brilliant. We'll try and pick them all up within the session, but anything we don't get to, then we'll make sure we get answers out to everybody after. So with that, I'll hand over to you 3, if you don't mind. I'll let you take it from here.
That's lovely, and thank you for the introduction. I can see that Ruth is messaging in the main room to say that she's not been put into this breakout room. I don't know if anybody can help Ruth with that, because obviously she's presenting alongside myself and Marion. So, but I'll kick off anyway and share slides. We can kind of just make sure that that's come through. Can everybody see that?
Yes, that's great.
Lovely. Okay. So how we came about doing this session, folks, was that I'd sent through a flyer about an event that we're hosting on the 6th of June, Dementia United, Lived Experience members and the Alzheimer Society for Greater Manchester. And I think it was Leslie came back to me and said, would you like to do a little bit of a taster about what the event's going to be about, which will be obviously around the topic of dementia in this session? So if we're honest, we're canvassing for people to come along and join our event, which is free. You can come in person or you can come virtually on the 6th of June. But obviously, as part of that, we're going to do a little bit of an overview about our programme, a little bit about the impact of the pandemic on people with dementia. We've factored in 15 minutes discussion time after that, because I think that's when people may want to just pose some questions, have a bit of a discussion. And then we'll go on to talk about the event and why it would be of value to come along and how we'd love you to promote it in your practices, really. So this is our event called Living Well with Dementia in Greater Manchester. Join us, we need each other. And we really do. So we do really need you. We'd love you to join us. So our topic in brief, we'll just give a bit of a impact of the pandemic, as I've said, a Q&A bit in the middle, and then we'll go on to talk about our event. And we're going to do a taster session of one of the event topics, which is on music, and then one on the Dementia Care Pathway as well, and then a bit of a reminder of all our resources. So apologies, there's no, my camera's not working. That's what I looked like 3 years ago. So if you come to the event, you'll be able to judge for yourselves whether I still look like that. Dementia United is the programme for Greater Manchester around quality improvement. And our aim is to make Greater Manchester the best place to live if you either have dementia or a family member or work looking after somebody. And this image just gives you an idea of the range of programs that we've got going on in Dementia United, and these slides will be coming out to you. There's a link at the bottom of the slide, and that has how you can get into our program and look at all the different resources we've got on our website. I think the important thing to say here, and I'm going to hand over hopefully to Marion and Ruth just to say a little bit, is that people living with dementia and family members and carers are at the heart of this image and at the heart of all the work that we do. Now, Ruth, have you been able to join? If not, Marion, are you there?
Yes, can you hear me?
I can. So, Marion, are you happy to just briefly mention something about the Dementia Carers Expert Reference Group?
Yep, I am. Yeah, it's Marion Coleman. I'm happy to be joining Helen and Ruth on this session to talk about our our work that we've been doing. I've been with the Dementia Carers Access Reference Group from the beginning, actually. It's probably getting on for 3 years now. And originally we were with linked into Tide, Together in Everyday Support. I don't know if people have heard of that organisation, but recently now, and for the last sort of 2 years, we've been working directly with Dementia United. So we're a group of people who are carers or former carers. I'm a former carer for my father, who lived with me and had a diagnosis of dementia. And we've been working on all aspects, really. We've tried to get involved in all the work streams that Dementia United are running or have planned. And we've been very much involved in this conference in terms of our input in what to cover, making sure that it was led by people that have been affected by dementia. And I live and work, well, live in Tameside and do a lot of work locally with our dementia lead, the hospital, local dementia groups, making sure that they can tap into information, looking at the support they need. And recently I've taken on a project with Playlist for Life, which is about the impact of music for people affected by dementia, which is coming up a little bit later in this session.
Thank you very much, Marion. I'm not certain because I can't see while I've got my screen sharing whether Ruth's been able to join us. So Ruth,
I think she has, unfortunately. I think they're having a few technical issues.
Right, okay.
They're coming, I'll let you know.
Okay, so Marion, I'll kick off and do this little bit. So it felt like when we were talking about having an event, one of the most important messages was to host an event where people could come together in person and connect virtually for those people that didn't want to come in person because of the impact of the pandemic on people with dementia. And I just thought it'd be really useful to highlight, and I'm sure you'll know this working yourselves, supporting people living with dementia and family members, the impact it's had. But there really are stark figures here that dementia was the single most common pre-existing condition of people with coronavirus on their death certificate. As well as that, the largest increase in excess non-COVID deaths were in people who have dementia. So, I mean, just incredible stark figures there about the numbers of people who've died over the last 2 years. And as well as that, the impact that's had on all of us, because this will have touched so many of you. And I do recognise and understand that, you know, it's touched us. We'd have family members or friends who we'd have lost, and the COVID pandemic would have impacted in terms of, and I'm a carer of somebody who has dementia, and I've, you know, have seen that person lose skills, lose the ability to use money, lose the ability to walk as well as they were doing, just because they've been in a care setting where they've not been able to get out and do things like they used to do. So quite a lot of reports of people feeling like they're deteriorating far too early than they would have done. In terms of the information that's on this slide, we've taken this from the Alzheimer's Society reports, and the links are there if you want to find out more, because it makes for stark reading, but it's really important to read, and it almost sort of drove us to think about getting together with our lived experience steering group to think about what we'd like the conference to do as a result of this impact of the pandemic. And as you can see on there, that we've got a real increase in the number of people reporting symptoms getting a lot worse during lockdown, but also care home managers saying that they've seen the impact, if somebody was in a care home, of not having that family visit in order to maintain somebody's well-being. Ruth, were you wanting to come in then? No? Okay. Interrupt me, Ruth, if you do manage to join us. In terms of the impact on family, friends and carers and care partners, again, this has come from the Alzheimer's Society report. 73% of carers reported the caring responsibilities increased during lockdown. And for so many people, they didn't have access to the usual day services, allotment groups, singing groups, dancing groups, or just meeting up with friends and family that would have been a support and to share the burden of caring. So 76% reported their caring responsibilities had increased, and also they'd seen the person's dementia symptoms increase as a result too. And just a very stark figure at the bottom there, 100 hours of caring a week. So that's a massive increase that people have been reporting they were doing over the last 2 years. So family and friends have also been coming forward reporting that they're feeling lonely themselves, overwhelmed with guilt if they can't support somebody in a care home. And that was a real key message that we kept hearing over and over again, that people weren't able to get in to support somebody that they were watching deteriorate, and how that hit them really. So a lot of stark figures on here, and I suppose we were hoping at this stage really just to, and I'll stop sharing my slides at the moment, to pick up on a couple of things. I think questions must have gone out to yourselves who are joining this session today, and these 2 questions came back to the audience. Now, I don't know if that's to us or to everybody, so I've put it on the slide, which is, why is the support different in care homes compared to people in the community settings, was one question. And another question was, what's the best way for a GP practice to support carers for people living with dementia? And I guess our question to you is, what do you think about those, and what can we all do to improve the support and care that people get? So I'm going to stop sharing my slides now, come in and just see if there's anything in the chat. Ruth's very kindly joined us by the looks of things, which is lovely, Ruth. So I just was going to try and pick up on anything that anybody wanted to come in on any of that. So anybody, anything to say so far? Our thoughts of the 2 questions that were posed to us. The first question that was posed in the chat, and I don't know if anybody wants to come in on this, is how come there is a difference between the support offers that are available to people in care homes and available to people in the community. And our views, and obviously I'm not speaking on behalf of services, I'm not a service provider. We are the programme of work around dementia, but we're not the providers of those services. What we do see is that there is variability across Greater Manchester, and we know that to be the case. And we've been working for some time to try and agree what we would have as the minimum standards of care and service across Greater Manchester. As well as that, we know that the funding streams and the way that services are commissioned are very different in each of the 10 localities in Greater Manchester. So that kind of almost explains it as well. So there can be a combination of funding streams and the way services are commissioned. So those of you perhaps that work in Trafford will maybe know that if somebody goes through the memory assessment service in Trafford, they're automatically referred into Age UK, who provide a post-diagnostic support offer. Now, that's not the case in all 10 localities. Some localities will directly refer you into a service that provides post-diagnostic support, but some don't. Some localities are doing some very proactive work into care homes, looking at the diagnosing of people with dementia, perhaps at later stages, using some tools called Diadem. It's a great tool that can be used by GPs, doesn't need to be memory assessment services that use it. And again, that's not across the board in all localities. So part of the reason for having the event and why we're talking to you today and really wanting you to come along is that we want to try and level up and get everybody to that higher level and standard, so that we do have people receiving a similar service across all of the localities. And I'm almost stealing my own thunder by talking about the pathway in advance, but we've developed a pathway over 3 years with all the standards across Greater Manchester, from preventing well to diagnosing well, living well, supporting well and dying well. And we're trying to make sure that all of the localities have service offers against those standards. And we'll come on to that briefly at the end. So anybody, anything else they want to ask us or put to us, rather than have us talk at you, because this was our discussion point at this stage. Have you been hearing from people living with dementia and family members who've really struggled during the pandemic? happy to move on because I can't see anything in the chat, Maria. Is that okay? So people can obviously come.
Absolutely. There's nothing in the chat at the moment.
Okay.
No questions or anything. So yeah, feel free to carry on. Thank you.
Okay. And Ruth, lovely to have you join us. Sorry you've had such a struggle there coming in. So one of the other questions at the bottom was, what's the best way for GP practices to support carers? Ruth and Marion, do you want, is there anything you'd want to say on that? We'll pick it up in the pathway conversation, but was there anything in particular yourselves being part of the Carers Expert Reference Group that you've seen that you'd welcome to feed in?
I'll come in if you don't mind, Helen. It's Marion. Yeah, I mean, talking to the groups that host activities for people living with dementia and their carers in Tameside and just generally, I think one of the things that have slipped by now is the carers assessment that needs to be reminded that this is something that carers can ask for and have one, but also and I'm sure Helen will cover this in the pathway, is about, you know, the fact that there are, or there should be, annual reviews with GPs for people living with dementia. They unfortunately during the pandemic have slipped by, so we've really got quite a big backlog of people who haven't really been seen for possibly 3 years now. And as Ruth, as Helen mentioned, you know, people have deteriorated. Circumstances have changed for both the carer, the family carer, and the person with dementia. So I think, you know, if you are in contact with people affected by dementia, it's about reminding them that they need to pick up on these offers that they need to tap into sooner rather than later. And just generally, when I've been talking to carers about attending appointments at GP practices, you know, about allowing enough time for people. A double appointment would be fine for the carer and the person with dementia. Appointments in the afternoon rather than early morning. Just those kind of things make life so much more easier for the carers and the person with dementia.
A really good response there, Marion, and I just want to add to that and say that one of the programs of work that we've been doing with Marion and other colleagues from our Carers Expert Reference Group, but also people living with dementia, is we've been working on a Dementia Wellbeing Plan, which is a care plan document. And we were hoping to have this as a digital version available initially through Black Pear, and obviously those of you that may be involved in some of that early work may know about that from some of the practices that were involved early on. And now that's with GraphNet that we're working towards having a digital version as a proof of concept. But in the meantime, we didn't want to wait and not have something available, because we developed and piloted a dementia wellbeing plan in a number of localities before the pandemic. So we've actually added the dementia wellbeing plan, all the resources about the plan, including some training resources on dementia that I'm sure you'd find very valuable to be clicking on and using. But hopefully the wellbeing plan itself is designed to be a what matters to the person affected by dementia conversation, and you might be able to just download that and use that straight away. We've just been doing some films with people living with dementia and family members promoting that dementia wellbeing plan, so look out for that. That'll come in due course. So if you're interested in finding out about the film or any of our resources, do get in touch. But I'll move us on, I think, if that's okay. So
Hello. There is one comment in the chat. Do you want to do that now? Do you want to do it at the end?
Oh, thank you for pointing that out. So, and I thought I was sharing my screen. I don't think I was then. So, just bear with me. I've lost. Do
you want me to? I can read it. See if that's.
I think. Sorry, if you wouldn't mind, because it's locked me into the slide. The slide. I can't see any chat.
Great, isn't it? Yeah, no worries. So it's from Jane Atherton, and she said, I have 2 parents living at their home with dementia, mum mixed, dad vascular. Not really had much support, care packages in place with my additional support. Stroke team and stroke association supported dad with most recent stroke, was offered a carers assessment but no further intervention. GP's not even done a face-to-face review. And then she's put dad's probably 4-year diagnosed now.
I mean, what I would say, I mean, this is what we're hearing, is that there's probably been very little contact, as I mentioned, really, with that impact of the pandemic slide, and Marion's mentioned that people are really behind in not having a review. And the other intention with having the Dementia Wellbeing Plan available on our Dementia United website, and why we've been doing the filming, is we really want to promote and push people living with dementia and family members downloading the wellbeing plan or filling it in, making contact with your doctors and saying, can I have an annual review? Actually, you know, taking ownership and leading on, I'd like a conversation about care needs and what support's out there. So, you know, absolutely, Jane, this may be a great opportunity for you to have a look at the resources. What I will do before the end of the call is just see if I can get them up on the website and put that straight into the chat so people can have a look and use that straight away. I'm a family member of somebody with dementia, and again, I've had no review, and support needs have needed to be reviewed, and I just did that and made contact and said, can I have a conversation? Because I think what we're finding is when you actually proactively do go in and ask for that, and even if ours was done over the phone, it wasn't done in person, but at least under the headings that are in that wellbeing plan, it was a prompt for me to say, can I have a review of, where can I get support of, and so on. So, you know, this is me as a family member to another clinical colleague saying, you know, by all means do that. And our Dementia Wellbeing, our Dementia Pathway, sorry, which will be at the event we'll be promoting, it'll be going live after the event, we'll have all the different services that are on offer in all the localities across Greater Manchester against those standards. So you'll be able to click in and see what's available, and we're just adding those in now, so they are accurate and up to date. So that's a really good resource that I hope will be of value. So I hope that answers that, Jane, and best of luck. But I will try and move us back on if that's okay, and because I think we're a bit short of time. I don't mean that we need to rush, but I think we want to delve into the event itself now that we're promoting. So all right, have I managed to share my screen now again? I probably shouldn't have stopped sharing. It's always a slippery slope. Right, has that come up so people can see that?
Yep.
Lovely. Okay, so I'm not going to go into full slides at the moment, because I want to click onto a music link in a minute, which you'll see. So the event itself is on the 6th of June, and the audience for the event is anybody and everybody in Greater Manchester, whether you support somebody living with dementia, whether you're a family member, whether you yourself have dementia. So please, can we ask you to promote the event? We really want as many people as possible. It's an opportunity to hear from you all, because there will be a lot more time than we've got today to have discussions about the impact of the pandemic and what people are having to do and how they're having to cope. But as well as that, we're actually focusing on all stages of the pathway in breakout sessions. So we're having concurrent, so running at the same time, breakout sessions on prevention, on diagnosing well, on living well. We've got 3 topics. On supporting well, we've got 3 topics, including a very detailed session on the pathway, and then a session on dying well as well. So you can join in person, you can join virtually from your home, from wherever you work. Also, you know, please encourage all the sort of patients that you see. If you can put the flyer up in your practices, that will be really helpful as well. Remind people if you can send anything out on a mail shot. I've certainly sent the flyer in, so hopefully you've got that, and you know, we can send that again if you'd like to have it, because we really want as many people as possible joining us. We've got Andy Burnham, who's hosting who'll be on our panel. We've also got the Chief Executive of the Alzheimer Society. But this event has been co-produced by people living with dementia. So the topics on there are topics they wanted to cover as a result of the impact of the pandemic. So it's absolutely driven by people that really wanted to hear about these things. So the next slide just gives you a taster of the topics that we've got coming up. We've got a gospel dementia choir. I think we're going to probably have another choir as well for a soft opening. I don't know who the choir is going to be when we start. And then these are the topics that we're covering. So And Marion is going to just delve us into the taster session of the Preventing Well, which is arts, music, physical health and activity. So it's only a 2 or 3 minute taster now about that session, because we really like you to come along, and that's going to be in person at the event in central Manchester. But you'll see some of these are virtual, so if you were connecting virtually, you'd be able to click into the Diagnosing Well, or maybe you'd want to click into supporting someone from an LGBT community, or it might be employment and dementia for somebody from a working age, a younger person, or it may be that you'd be interested in the launch of the Dementia Care Pathway. So that's the topics that we've got available, so hopefully be able to join us. Now, Marion, I am going to leave the slide as it is, because as you know, you want me to click on something. Are you able to see that and speak to that slide? Is that okay to bring you in?
Yeah, I can see that. Yeah, so as Helen said, we've got various breakouts and workshops happening that day. And just to say that if you, Helen mentioned about attending either in person or virtually, that some of the localities are actually hosting an event in their locality where some of the information is going to be streamed. And I just noticed that there was an email in from the memory clinic at Tameside Hospital. They've opened up their Whitaker suite for people to come along, and if they can't get to the event in Manchester or simply don't want to travel, they'll be running a sort of a local event in that's linked into the Manchester event. So you know, you might want to look at if there's one happening in your locality area as well. I'm not sure if I've got all the details of where they're happening, but we've certainly got them spread around Greater Manchester. So as Helen said, we're running a session on music, arts and movement, and this is really about brain health and us trying to promote prevention, but also support with this aspect of how do you live your life with dementia, and using things around music, arts and movement to improve well-being. So I think I'll be talking a little bit about the music there, because I've been working with a charity called Playlist for Life, and I've been raising awareness about the impact of music and promoting music as a well-being option for people affected by dementia. So I think on the slide there we've got quotes there about what the research is telling us about these things. And music is absolutely phenomenal, actually, because it just affects all parts of the brain. It's one of the few things that if different parts of the brain cease to be able to function well, music seems to be able to still operate within other parts of the brain, so people can still get the benefit from music. So I'll be talking a little bit about how that works, but I'll also be trying to share what's happening musicality wise across Greater Manchester. You know, we've got things from dementia discos to the relaxed performances that the Halle are doing. We've also got Manchester Camerata run Dementia Cafe. We've got local groups doing choirs. We've got music sessions, music therapists. So there's a lot of things that maybe and we're tapping, sort of working with the social prescribers as well to raise awareness about this, where you might be able to signpost some of the people that your patients that you work with into some of these things. And I think we're just going to show the clip now that I found somebody sent me about the work that's been doing in one of the Scandinavian countries around music.
Have a go. I'm hoping this is going to work now, folks. I'll just make that into... Has the sound come through?
Yeah.
Hopefully that'll stop sharing now. I'll just go back. Sorry, folks, just getting it back up again. Back to you, Marion.
Well, yeah, I think that sort of encapsulates two bits really about how important it is to get a diagnosis, just how music as well can still connect people together, and how you know, it just improves not only the well-being of the person with dementia, but also for the carers. We use music quite successfully when we were caring for Dad in many ways. It you know, it's not the be all and end all, but it certainly is something that carers can as a strategy can use quite successful if it works for them.
Thank you. So as Marion said, that's only a taster, a 5-minute taster, folks. So do please come along. It's going to be a very exciting, interesting session. I think the Camerata are coming along for the session as well. And I think there's going to be some movement and activity during that breakout session. It's going to be an exciting one to be part of. So hopefully you'll join for that one. So I'm just going to mention the Dementia Care Pathway. And again, that's another breakout topic. And would love you to join this one. So we're not competing, obviously, but this one's going to be live streamed. So if you're connecting virtually on the 6th of June, you'll hear a lot more about the pathway and why we need it. And the goal of the pathway was to enable everybody, whether you're a family member, a person living with dementia, whether you're a staff member, a commissioner, whoever you are, we wanted to enable people to navigate and find the care and support that they need. And I noticed that I'm partway through a sentence on that, so apologies for that. So the pathway itself brings together all the requirements and recommendations that we consider are important, from preventing well right the way through to dying well. We've worked on these, co-produced these over a number of years, 130 people affected by dementia. So people with lived experience all contributed to the standards and why they're important. And we've got all together 76 standards now that all form part of this preventing, diagnosing, living and supporting well. Now, I don't know how much time I've got left, Maria, so I didn't know whether it's worth me just showing people what it might look like, do a little bit of a quick flash up of the pathway, if that's possible. Yeah. But if not,
we've got 5 minutes. We will get a warning just before, but you've got 5 minutes.
But I didn't want to do that if we had lots of questions coming in, so I'm just going to pause a minute, Maria, in case there's anything. So I wanted to allow a little bit more time as well. But
so far, so it's just comments that the video was really moving, and Jane just saying, yeah, thank you for your response before.
Okay, lovely. So I think what I will do then, I will cheekily put it up, folks. When I share these slides with you, do bear in mind this is still in development. This is a live testing staged site. It's not gone live yet, and the link will go down from this testing stage site, and we'll put up the live link after the 6th of June. So and I just need to reject cookies. So this is what it will look like. You'll be able to click in wherever you live. I'm going to go into Oldham. When you go into Oldham, there'll be a little bit of information about Oldham itself, and then under each of the stages of the Dementia Well pathway, there will be let's see if I can get one up to show you. So one of the standards is at least 2/3 of people with dementia should receive a formal diagnosis. If you click on Learn More, okay, there's also a feedback thing, but it comes up with the different offerings at a locality level, and then the national offerings and all the evidence and all resources. So we've got 76 recommendations, all with, so memory assessment services should respond to a referral within 2 weeks, and so on and so on. You can see each one. When you go into each one of these, you can download them and you can print them. So you could actually download and print them and have them as recommendations that you keep for your locality, and also you might just want to download and print them for something that you hand out when you're actually seeing patients and family members as well. But also we'd love you to be promoting this resource, letting people know, because this is going to be the way that people find out all in one place what's on offer across Greater Manchester. There's so this is just a very quick sort of stop. Let me just go back to and it tells you a little bit about how to use it there, and how we've come about bringing it all together. So we'll be talking through that at the event. So do join us. I'm now going to go back to our slides. I'm hoping that Ruth's in now, because I know Ruth really did want to come in and speak to us, because Ruth's the chair of our Dementia Carers Expert Reference Group. And Ruth, are you happy to sort of come and draw everything to this last slide?
I don't think she's managed to get in, unfortunately.
Okay. Oh, what a shame, because I know. So our next steps really for yourselves are promote the event, please. So please, you know, let people know about it. There's a lot going on. We're launching lots of stuff. We're showcasing, we're talking about the things that people can be doing right now to support somebody living with dementia. I appreciate that the event is also going to be a time for respectful reflection of the impact of the pandemic, and we will factor that in as well and enable people time to share their experiences and hear from each other. We've got pledges that we're asking the mayor and sort of all of the commissioners and senior exec team from Greater Manchester Health and Social Care Partnership with the integrated care system to take forward as well. So register for the event, share all the resources, Dementia Wellbeing Plan, the arts and music. There's also a session on delirium, and I'm going to stop now sharing my screen, because I'm going to put all of those into the chat so people can follow up. So I don't know if there's any final questions or any asks of us.
There's nothing in the chat. We've got about 1 minute if there's anybody that wants to ask any questions, but thank you so much for that, because that was really inspiring actually, and the event looks fantastic. So hopefully that will drum up a lot more engagement for it as well. Are there any final questions before we get moved back?
I've put a link to our website in the chat, because I think rather than put in each of the different things, because our programme covers so much, that so if you want to find out about the Dementia Wellbeing Plan, Jane, that's under post-diagnostic support. There's information on delirium, end of life, you name it, it's all in there. So people do click on it and find out. And we also have a bulletin that we do every 2 months, and Dementia United. So if you do want to be added to the list and receive all the updates on the programmes, any new work that we're doing, please do include, send your emails over to us. So I'll just put my email address in the chat, and I'm very happy to add